Welcome to Chapter 15 of Stress Management, talking about healthy lifestyles. Here we go. Healthy lifestyle. Stress is known to influence health through its direct physiological effects and also through its indirect effect via altered health behaviors. So taking care of your body is an important stress prevention strategy. So if you think in reverse, stress affects us mentally, which affects us physically. Again, we can have an effect on our mental state, which again affects how we react to stress by doing things that are physiological in nature. Okay. Also, stress makes us not always want to take care of ourselves the best way too. So by making a plan and being determined to do those things, it also helps us to combat, just going through moods where we don't want to do things that are good for us. So exercise is a stress buffer. The body uses excess blood sugar. Muscles use the stress hormones, adrenaline, cortisol, and other circulating fats in the bloodstream are used for sugar. For sugar, for energy. So again, when we exercise, we can use the excess energy that we have in our body, right? We'll release hormones that act and react that help our body to feel better. Again, we talked about cortisol and its effects, and again, cortisol gets a bad name, but small doses of cortisol are actually good for your body, right? When it's planned and it's again the stress reaction that we have that releases it is fine. It's just when it's constantly flowing, because we're constantly stressed, it's a bad thing. Okay. Regular exercise has beneficial influence on more than physical health. You feel better emotionally, function more efficiently, release of serotonin and endorphins can happen, reduction in overall cortisol release, muscle relaxation, decreased risk of using alcohol, smoking, and overeating. Again, decreased risk with those. There's not like it's not like if you're a smoker, you're like, okay, if I exercise, it's going to keep me from smoking or overeating. It's just decreased. Again, a lot of times when you exercise, you may become more purposeful in what you do to your body overall. So you may make some better health choices in general. Again, if you exercise a lot, you may find breathing a necessary thing. Therefore, you may not want to continue smoking habits. Same thing with the effects of alcohol or overeating. If you're trying to get in better shape and so on and so forth, you may decrease the use of alcohol and decrease your eating habits a bit. Again, other benefits of exercise: improved moods. Again, there's endorphins can be released, things like that. Again, sometimes when you just like put your body through the ringer, and you get a lot of time to think about things. You get it just you feel accomplished, things like that. Improves your mood, reduces anxiety. Again, you can focus all your time and energy on what you're doing physically. Takes your mind off of the other things going on in your life. Again, a lot of folks that are stressed just feel tired, and when you exercise, your body is forced to become stronger, right? And whether that's endurance wise or physical wise, it increases your energy. Right? It's one of those weird things I try to get in people's minds. They're always like, I'm too tired to exercise. I'm like, exercise will increase your energy. Yeah, but I'm too tired. Like, that's why you got to go do it. Right. So endorphins kind of kick back up into the improved mood. Withstand cardiovascular and respiratory effects of the alarm stages of stress better. Um, Again, your body will be heightened during stress, and again, cardiovascular and respiratory effects of that. But again, your body will better withstand that when it's trained better, right? And that gives you a sense of control. You may have things that are going on in your life that are out of control, but you can control your exercise, right? You can decide, hey, I'm going to go for a run. I can go lift weights. That's in your control. So you can control what you do physically with your body and do something good for yourself, right? For better health, take a walk. Individuals who walk 10,000 steps per day have Improve post-exercise heart rates, better total cholesterol, improved flexibility, better overall physical and psychological well-being. So I get this question a lot. Well, should I start walking? I'm like, well, what are you doing now? Nothing. Yes, you should. Now, I get multiple questions like, well, is walking better than running? Depends on why you're asking. Do you want to burn more calories? Yes, no. Do you want to improve cardiovascular shape? Yes, then no. Is it, if I tell you running's better, but you refuse to run, therefore you're not going to waste your time walking, then no. Okay. It's all on how you look at it. And now again, I mean, I work out all the time. I run all the time. I lift all the time. I still go for walks, and it's still good for me. It's not like it's a waste of time by any means. But it depends on what you're asking. Now, if you're trying to avoid doing something that's harder on your body, but you need to start pushing your body more, and it's walking versus doing something a little more challenging, and you're at the point where you need to start doing something more challenging, you need to do the more challenging thing. If it's between, um, I'm looking for an excuse not to walk or do something challenging, and so I just don't want to waste my time walking. Walking is 1,000 times better than doing nothing. Okay, so understand that. All right. People seem to ask me questions when they're always looking for excuses not to do anything at all. Components of physical fitness. So there's 5 components. We got cardiorespiratory fitness or cardiorespiratory endurance, you'll see. Put on things, muscle fitness, we got strength and muscle strength and muscle endurance. Differences: muscle strength is like how much weight can you lift, muscle endurance is how long can you do it, right? So an example would be like, what's your 1 rep max? Bench press would be strength. Muscle endurance for the same motion would be how many push-ups can you do before you fail, right? Flexibility is exactly that. How far can you stretch, right? So, can you touch your toes? Can you do the splits? Those type of things. The more flexibility, or if you answer yes to those things, you have more flexibility, right? Body composition. This is fat-free mass versus fat mass, right? So you have a body fat percentage of 10%, 20%, 30%. That's body composition, and your muscle mass and bone mass and water and everything makes up the rest. Okay. Or, well, I guess tissue mass, bone mass, and water, or fat-free tissue mass. Let's put it that way, to be exact. Okay, so choosing your exercise. Which exercise is best? Any exercise that you enjoy, is healthy, and you'll do. This is so important. People want to make things way harder. Now, again, if you have really, really strict goals, I guess, like you want to be a bodybuilder, like you want to be a professional football player, you want to swim the English Channel, then the exercise you choose needs to fit those goals. So for example, if I want to swim the English Channel, powerlifting and doing nothing but powerlifting is not going to help me towards that goal. Okay. If I want to be if I want to be a power lifter, running marathons and training for marathons is not going to help me be a better power lifter. On the other hand, if I just want to get in better shape and I got to pick stuff that I'm going to enjoy, I don't like lifting, I don't like running, I don't like any of your typical exercise things, but I do like to go play full court basketball, then go play full court basketball every day. Just go do it. If there's groups of folks playing basketball, like at a local gym or whatever else, and you can go jump in and go play like for an hour or a couple hours, whatever, like you got time to go do that. Oh man, by all means, if you like surfing, go surf, go stand up paddleboard, whatever it is, kayaking, it doesn't matter. You're out there, you're being physically active. It does not matter. And it doesn't have to, when people think exercise, they think you got to join a gym and it's got to be all that stuff in the gym. That stuff is good And, you know, I'm not downplaying that by any means, because I spend most of my time in the gym. I spend most of my time running, doing the things that most people tell me they hate to do. But I also like those other things. And if that's all somebody wants to do for their exercise, that's okay, right? You're doing something good for your body, and if you enjoy it, that's even better, right? Um, so the things that help people stick to exercise is they enjoy it. Convenience. You know, it's not, you don't have to drive 30 miles to get to do it. You know, social support. Other things that, you know, may help you stick to it, that they didn't put on here, is when you see changes, you know, like when you see improvement, that makes you want to keep doing it, right? There, a sense of mastery of what you're doing is huge. Couch potatoes in the making. The highest rate of decline in physical activity occurs in early adulthood, periods between 18 and 24. Nobody's making you do it. You know, a lot of folks maybe have played sports. By the time they get through high school, their sports careers are done. And now they don't have to train for sports and things like, you know, it's easy to get lazy. You know, that's why we've got the freshman 15, right? A lot of freshmen who were somewhat active, whether they're in sport, you know, we're just busy all the time, or they're just constantly doing things, or they're in sports, or whatever it is. They hit 18, they go off to college, and it gets real easy to sit around and do nothing, right? You know, life starts taking over, and they just don't find the time, or don't make the time. All right. So workouts at work. You know, again, you do whatever works for you, right? So your mood is low, you're feeling dejected, listless, apathetic. Move for at least 10 to 30 minutes at a mild to moderate intensity. Focus on your body, not your brain, until you can feel yourself regain vitality. Again, I'm not, I don't, the thing I don't like about this one is it's trying to tell you, like, if you're feeling this, do this. If you're feeling this, do this. If you're feeling, in all honesty, you know, if this stuff works for you, you know, like you get down to the one at the bottom, you know, lift weights, punch a bag, or jump rope, you know, you know, it may be something that you're not really into, right? In all honesty, however you feel, you know, so whether it's you, like, you feel your mood is low, you feel dejected, you're bored and tired, you're nervous and hyperactive, restless and complaining, any exercise you go do is going to help, as long as it's something that you'll go do, right? There's not a, you know, like they almost make this like it's a prescription. You know, again, they're going off of some of the, you know, like these things tend to make you feel this way with this, you know, but everybody's different. So, you know, you pick something that works for you, right? Um, it's a, it's a, you know, it's not a one size fits all type of thing. Okay. Um, Tools for a healthy diet, dietary guidelines for Americans. The choosemyplate.gov is a good tool to use. Um, again, nutrition and stress. Body gets energy from three sources. So carbs, fats, and proteins. Again, you hear a lot of times on people's Instagram pages or in the news, you know, like carbs are horrible for you, or they'll say fats are horrible, or can't eat too much protein, it'll kill your liver and kidneys. Those people are all idiots. You know, in all honesty, we can overeat all of these and we can undereat all of these, and overeating and undereating all of these can have effects. Now, protein for the most part does not. The only time protein you'll see a bad effect with protein is if you overeat protein and you cut the other two out, because in your body it has to, you know, like overwork to process and use the protein in many different ways. That's about the only time, you know, so you've cut your carbs and fats completely out. You know, your body likes to use carbs and fats as energy. Those are your two main energy sources. And again, carbs are the main energy source that's easiest on your body to use. So it's not a good idea to cut any of them out. There's just appropriate levels of, and when you look at the total calories, what you want to stay at. So you want to balance those. That's the big thing. One, make sure you have a nice balanced diet of all of them. And then two, just keep your calories below your expenditure level, right? So the intake's got to be below the expenditure. and you'll see weight loss. Or if you're just trying to stay straight, try to balance it where your energy is somewhat equal to your expenditure. Or again, sometimes if you're trying to gain a little weight, you got to eat a little bit more. The thing is one thing you don't want to do is, if you want to see huge spikes in weight and the type of weight you don't want, man, double up on your calories. You'll see that. And in that same thought process, don't do that to lose weight. Neither one of those is a healthy move. Okay. Gain weight slow if you want to gain it. Gain and lose weight slow if you want to lose it. Okay. Big shocks to your system like that don't work. Do I need a vitamin? You know, this is one of those things that, the way I put it, if you can get all your vitamins from your food sources and you get enough, great. That's really the best method. If that's not practical for you, then just get you a normal multivitamin. You don't need something that's like quadruple the amount. That's not a good idea, because again, most of you probably have no idea how many vitamins and minerals that you get from your food, and who knows if you're getting toxic amounts of any one of them. All right, so just get a normal multivitamin if you're going to do it. Don't go crazy, right? Cut stress, reduce diabetes. So stress reaction can spike glucose levels and lead to poor eating choices. Patients who control their stress tend to do a better job of managing their diabetes. Again, best way to control stress is exercise. Best way to control diabetes is exercise. Boom. Like, it does both. Okay. Again, we're talking about type 2 diabetic here. Okay. So don't, type 1 diabetics, again, where with the type 1 diabetic, it would help with the stress, which might help with you managing your blood sugar. And again, be careful, because again, it can drop it and everything else. So you just got to be careful and manage that. But if you're looking at it from a standpoint of where it has like multiple direct effects, we're talking about type 2 diabetics. Fresh fruits and veggies contain many of the vitamins and minerals we need. So, they're good to have in your diet. Legumes, high in fiber, loaded with important nutrient. Again, good to have in your diet. And whole grain. Oh, the carbs in the whole grain and legumes and fruits and veggies. Oh my gosh, right? No, carbs are not bad. If I can get anything into your head, carbs are not bad. I don't care what Dr. Fung says. He may have a doctor in front of his name, but there's a lot of us with doctors in front of our names that are complete morons, and he is one of them. So don't listen to him. Anyways, result in more stable blood sugar level, and as a result, a more stable mood and energy level. Right. So again, these are all good things to eat. All right. Don't let anybody tell you otherwise. And water, low water levels in the body can affect our moods and perceptions dramatically. Again, when you're dehydrated, you don't feel that good, right? Nothing. Your body does not function at full capacity when it's dehydrated, right? So make sure that you're hydrated. Again, where can you get water? Well, you can drink it from water. You can get it from sodas. You can get it from juices. Just when you're doing that, make sure you're not overloading your body with liquid calories or anything like that. That's going to put you above the levels that you need. But yeah, you can get water from multiple sources. You also get water from food. Again, a lot of those pastas and things, those bad carbs, oh my gosh, they're loaded with water. That's why when you cook pasta, you get this little hard noodle. And then when you add water to it and you boil it in water, man, it swells up and gets all nice and soft. What? It has water in it. Fruits and veggies have water in it. Meats have water. I mean, all foods have, water in it for the most part. So again, you can, drink your water from multiple sources as well as eat water. I know that sounds weird, but you do. You eat food and it has water in it. Hidden sugars. Be on the lookout for hidden sugars. Sugars are not hidden. They're just hidden if you're ignorant, right? Sodas, energy drinks, sports drinks are to blame for 36% of added sugar in our diet. They're not to blame. You are to blame. If you don't know they're there, that's your ignorance. right? Everything you eat, you should know what's in it. They put it on the package, right? Again, people, like to look for culprits like, oh, it's sugar. No, the sugar's in there, and sugar's fine. Like if you want to eat a cookie's fine. Just don't eat a whole box of cookies. um, there's nothing wrong with the little sugar here and there, right? Again, all carbohydrates. What happens to it when it enters your bloodstream? Everything turns to glucose. Doesn't matter what the carb is. Doesn't matter if you got it from fruits. Doesn't matter if you got it from vegetables. Doesn't matter if you got it from soda. It doesn't matter. It all turns to glucose, right? So there's not. I hate that they write it this way because it's not to blame. The blame is that we go through life not paying attention, right? If you don't pay attention, if you're walking and you're typing on your cell phone, you're texting or looking at Instagram, and you step off a curb and twist your ankle, it's not the curb's fault for being there. It's not even your phone's fault. It's your fault for being an idiot, right? I mean, that's what it is. This is the same thing. There's not hidden sugar. I hate that people use these terms. It drives me crazy. It's there. You just need to be aware of everything that you're eating. Now, again, I'm not saying you have to count your calories. If that works for you, great. I'm not saying that you've got to, like be hyper vigilant about everything. You just got to be educated. And it's not hard to educate yourself. Read the food. All right. Gosh, people drive me crazy. Caffeine. Again, this book is really not written by a smart nutritionist. So this is where I'm going to um, agree to disagree with whoever put the stuff in here. Caffeine. In some people, it may increase their stress hormones. It doesn't do it to everybody. In fact, caffeine has more health benefits than a lot of things. Coffee is a great has a lot of great benefits to it. Okay, there's a lot of benefits. Caffeine's a great ergogenic aid. It improves focus, it improves mood, and it improves alertness. Again, don't avoid it. Now, again, you don't want to be like super caffeinated all the time. Again, too much is always, it's like everything else. Too much is always bad, right? We got that middle ground, that moderation. Trans fatty acids increase plaque deposits in blood vessels, raising risk of heart disease and stroke. Again, you don't have to avoid it. Trans fat this one is actually one you should limit. Okay, so that one's okay. Soft drinks. Again, depending on what type of soft drinks you drink, may not have any sugar in them. And again, every once in a while, if you want a Coke, like having a good, a nice cold Coke on a hot day, especially get the bottle Cokes, man. I don't know, something about the bottle versus the can. It can kind of improve your mood if you're one of those kids that grew up on Coke, and sometimes it's like it's almost like visiting an old friend every now and again. I don't drink a lot of Coke anymore. I used to drink a lot of Coke when I was a kid, but sometimes it just does. Like I'll just have a Coke, and sometimes it just kind of takes me back. And again, it's something that like just like you feel satisfied. Yeah, those are good things. It's just when you overdo it, it becomes an issue, right? And again, if you drink diet sodas and things like that, there's going to be 0 calories in those, and some of them have caffeine, some of them don't. So if it would need more caffeine in your day, then that's fine. If you're trying to avoid it, that's okay too. I mean, again, this is what happens when you have non-nutritionists write nutrition stuff in here, or you get a dumb nutritionist write nutrition stuff. And I don't know who wrote this particular chapter, but I'll call you out. Overeating, that's the biggest culprit. We're overeaters. We overeat everything. It's not carbs, it's not fat, it's not protein, it's not sugar. We overeat. The biggest contributor to obesity is overeating, right? And I know people are going to say, oh, well, I've got bad genetics. We don't have bad genetics and good genetics, and especially when it comes to metabolism and things like that. Here's the thing. no matter what you got going on, with like hormones, thyroid, anything like that, um, you can lose weight. Let me just throw that out there. I know there's going to be some folks that are like, no, my doctor told me it's really, really hard. I get that, and I know some really good obesity docs. If you want to follow them, Dr. Nadolsky is a great one to follow. Um, it- Physiologically, anybody can lose weight. Doesn't matter how screwed up stuff is in your body. Your body will use energy. Okay. If you eat less than the amount of energy your body loses, there is no way you're going to continue to gain weight, because the only way to gain weight is to be able to pack on storage of things such as either fat-free mass tissue or fat mass tissue. Okay. Now, again, where your genetics might play into this is what that number is. Okay. So again, your training levels affect this as well, but let's cut that. We're not going to talk about that right now. So barring training levels and how much you work out, you may have somebody whose body is really, really messed up. They can, if they eat more than 1,000 calories, say, because of, they've got some glandular issues or some hormonal issues, or, some organ issues and things like that. Maybe, like their body maintains at 1,000, where somebody else's body may maintain at 3,000. Okay. That's the genetic thing. But the person that's at 1,000, if they ate 900 calories a day and stayed at that, they'd see weight loss. The person at 3,000 could eat 200 or 2,900 calories a day, and they could see weight loss over time, right? Again, it's only a 100 calorie, drop. It'd be a slow weight loss in both of them, but it'd be one that, you'd see. So again, I get that when you say you have a genetic, also get this, it's not impossible, it's just hard. And again, if you have some stuff that's really messed up, again, go see a doc. They can help you with the hormonal issues, they can help you with some organ issues to aid your body to, be more efficient, or I guess maybe, be more or less efficient, so to speak, in where your body will burn more calories and things, so go see them and do those things, but it's not impossible. Okay. The tough part for everybody is the mental aspect of it. You feel hungry, when you start trying to eat less, you've trained your body to eat more than what it burns, and you've seen weight gain over the time. It's hard to get your body to eat less because you feel hungry, right? And so again, that's why I don't like people to do this whole 180 change where it's like, okay, now all I'm going to do is eat rabbit food, because it's not sustainable, right? So again, the things I always tell you guys is try to always increase your energy expenditure, again, through exercise, and all that is great. The other thing is just be more active throughout the day. Take more walks to and from the bathroom, or like take a longer walk when you're doing stuff. Um, if you know, park places, park far away, just little things like that, just be more active. Try not to sit around too much. Like, if you have a choice at home, stand up a lot, go do a lot of things, don't just sit and watch TV, go pick things that keep you active, right? It's really, that's the name of the game, is be more active, and then make little changes in your diet. Nothing crazy where you feel like you're on, the thing is to be on a calorie deficit diet, so to speak. And I hate using the word diet because it's got all this stigma with it. But to do a diet where you don't feel like you're actually doing a diet, right? You're just making little tiny changes here and there, right? Just little tiny things. Like, you don't feel like you're really sacrificing or killing yourself, and you're going to be more successful. Again, it may be a slow success, but that's fine. A slow success is better than a quick failure, right? Um, Childhood stress and obesity. Chronic cortisol secretion from chronic stress response activation in children may affect the timing of puberty, affect body comp, and cause early onset obesity, metabolic syndrome, and type 2 diabetes. Again, man, kids, stress out kids, you know, they they see some physiological problems as well, right? Um, and again, this day and age, kids get stressed easier. And there's a lot of reasons. There's a lot of reasons. Again, the technology, the type of bullying that they go through now, it's a little bit different. Um, you know, it's one of those things. It's almost, like sometimes I think it was better back in my day, like when people were more physically bullied, or like, like some kid would pick on you, you get in your fight. Once a fight happened, it was over. The only time you're stressed is before the fight. After that is usually like, okay, the whatever the you know the hierarchical shift was made during the fight, so and so is now like this alpha male thing or whatever. So you go through your fights, it's established, the two people shake hands afterwards, and a lot of times it was like, oh yeah, that's it, right? And now a lot of times there, the bullying can persist. You get online bullying and things like that. The other thing that, man, kids can't do stupid stuff anymore. Everybody's always recording something, right? And that stuff can follow you. Your most embarrassing moments can follow you. I mean, I love watching gym fails, but think about some of those folks, man, that were recording themselves like doing a clean, and they did something stupid, right? That follows them, and somebody will always bring that up. Hey, remember this? I mean, it's not like it used to be, where it's like, man, you did something stupid like that, maybe for a few weeks or something, or like a month. Like somebody be like, dude, remember when that happened? You're like, yeah, shut up, man, quit it. Um, no, that's different. The stress is different. Um, there's a lot of things that are different now. And again, I don't know that kids are necessarily as well equipped. I mean, we grow up in a society that is more worried about hurting their like we treat children like they have fragile egos, they have fragile, and so we try to cushion everything more. Where when I was growing up, and even especially the generations prior to when I was growing up, nobody's worried about your emotions. It's all about survival. It's just, you get those lectures like, so and so's being mean to me, and you get, like older cousin. I didn't have any older brothers or sisters, so older cousins, and parents, and adults would be like, well, you got to toughen up, or you got to deal with it. You got to. That's how it was. You know, your mom and dad didn't go down to the school and talk to your counselor and teacher about so and so's like hurting, like making my fragile child more fragile, right? Different times. And again, it's sort of, you learn to cope and deal with things at a much younger age. You know, and so now we don't see that as much, and now we're seeing some side effects from trying to be more sensitive to the kids. And again, there's good that comes with it, but there's bad that comes with it, as you can see here. Comfort foods. Students awaiting an exam report higher emotional stress and increased tendency to eat to distract themselves from stress. Most people's comfort foods aren't broccoli or asparagus or Brussels sprout. Comfort foods usually are high in calorie type foods. They are what they are. Probably one of my, like comfort foods to me, like I said, a cold Coke is a comfort food to me. Again, I don't drink a lot of it. I probably drink a Coke. I bet you I drink a Coke about once every 3 to 4 months. I'll have a Coke. Now during Christmas time, for some reason, I like to have a cold Coke. I like to drink Coke more during Christmas, so I probably have like over the month of December, I might have like 4 Cokes. I just during that month, and then the rest of the year, man, it's like every like 3 or 4 months I'll have a Coke. Something like that. Um, so again, it's not necessarily what it used to be when I was a kid. I used to drink like 3 or 4 Cokes a day. So, but again, that's a comfort food to me. Oreo cookies a comfort food to me. Again, at the holidays, there's a certain cookies that are comfort food to me. Just there's things, and again, none of them, most of them are a little bit higher calories, not, a little less nutrient dense, but you know, again, those have a good positive emotional impact on me. They just have higher calories that come with it, right? And again, I try to exercise enough and everything that to, like overcome that increase, but it is what it is, right? And again, a lot of times, like I don't have those things all the time either, right? Um, Stress and healthy eating, eating to cope, the food mood connection. Some people respond to stress by overeating. Emotional eating is often mindless and unrelated to hunger. And when we eat, dopamine is released, makes us feel good, and can help offset emotional pain. So again, there's a good thing about eating. And again, a lot of times the stuff that really helps you to release dopamine are usually foods that, yeah, again, are usually higher caloric foods. And yeah, emotional eaters will eat because they're bored or they're stressed or whatever it is, right? Um, when the body calls up the fight or flight response, it draws glucose from stored glycogen and fat. Glycogen stores are depleted, but the glucose that was released was not used for energy, and it's stored as fat. That will only happen if it's not used, right? So again, people have this weird thing that glucose just automatically becomes fat. That's why everybody's going keto now, right? Because somehow glucose becomes fat, but fat doesn't become fat. I don't know where they get that. There's a reason that fat is called fat, and we have fat stores, and we have fatty acids, and we have, all these things that are categorized in what we call the fat category, whether it's triglycerides and, the sterols, so cholesterol and so on and so forth. Um, those are all in the fat, right? Um, so again, glucose is your most primary used energy source. If you don't use it, we store it as glycogen. And if all our glycogen stores are already stored up, and we don't have anywhere else to store it, yes, it will get stored as fat. Okay. But again, that's the order it goes to, right? Bad habits contribute to weight gain throughout college. 76% of female students and 33% of males say they eat when under stress. 67% of women gained weight. 86% of the men did. Again, college people move less and eat more, right? It's just and again, the stress is higher, right? So we see a lot of folks that gain weight during college years. Stress and healthy eating, cortisol connection, activation of the stress response results in massive secretion of stress hormone cortisol. And one result of the continued secretion of cortisol is that the body stores fat in the arteries and abdomen. Again, it's not a direct effect. Again, they kind of make it like it's this direct thing, like, if you release cortisol, it all gets stored in the arteries, abdomen. Um, that's not necessarily true. It's just not necessarily untrue either. You got to go through a lot of different pathways to get there, and I'm not going to spend an extra hour explaining all this for this stress management course. All right, but again, we do see bad health effects with stress and bad stress eating. Okay. And with the release of the hormone, like, over release of hormone for prolonged periods, right? Eating disorders. So consistent use of food and food related behaviors to deal with unpleasant feelings and sense that these feelings are out of control can lead to eating disorders. Now they call this one runaway eating. Again, different books will just they categorize overeating or binge eating as an eating disorder. Okay. So you'll see it as you can see it as any, runaway eating, binge eating, overeating. So anorexia is when people self-starve and extreme weight loss, and this is this is not a when we get to eating disorders, there's disordered eating, which a lot of people, normal people that are like don't have the psychological diagnosis. There's a lot of folks that have disordered eating. Okay, a lot of folks that you would think are typically normal have disordered eating patterns. Probably 80% of the people I know have disordered eating patterns at times in their lives, right? Anybody that's going on and off of diets, they have disordered eating patterns. Okay, I'm just going to throw that out there for you. So if you jump on diets and jump off diets, and which is most people, disordered eating, right? Eating disorder is different. There's a mental capacity where they have basically, like, if you know, like you think of mental disease type thing. You have a shift where when you look in the mirror, you see yourself, you don't see who you are, right? So anorexia is that. So even, you know, like, and you'll see this, somebody like becomes like deathly ill skinny, um, and they they still continue to not eat and lose weight, right? They have this distortion of themselves. They don't see themselves correctly. Bulimia, the secretive cycle of binge eating followed by purging. And purging can be, you know, most common is throwing up. People like use exercise as part of their purging. They'll use, you know, like diet pills. Again, those don't really work. They'll use laxatives. They'll do all kinds of things, right? And then binge eating disorder is just periods of uncontrolled, impulsive, or continuous eating beyond the point of feeling comfortably full. You know, they just keep, you know, like, you just keep stuffing your face, so to speak, right? Um, Again, eating disorders are complex. It's, you know, there's behavior, emotional, psychological, interpersonal, and social. And again, once you have it, this is not something that your trainer or nutritionist is necessarily going to help you with. You need to go see a psychologist. All right, it's a psychological disorder. Okay, and again, biological and biochemical factors are involved, but this is a psychological disorder. Okay, you need help, right? 43% of Americans between ages 13 and 64 say they rarely or never get a good night's sleep on the weeknights. Hyperarousal caused by stress can upset the balance between sleep and wakefulness. Again, it alters chemical physiological balance. Um, Communication technology used before sleep is pervasive. Teens and young adults are more often sleepy. Coping with sleepiness also involves caffeine and naps. And again, you know, that's the thing. Sometimes people just don't quite feel fully awake. You know, you don't feel, you know, if you're not getting a good night's sleep, your body didn't do all its repair work that night. There's a lot of things that go into not getting good sleep. Okay. Um, Again, how much sleep is needed? 7 to 8 hours is what we, you know, like you typically see that, you know, like get your 8 hours of sleep and all that. Again, different people respond differently. Some people can be fully great on 5 hours. Some people may need more than eight, you know, they're just the way their body works, right? Or, you know, just, you know, different people. Okay. So again, do what works best for you, right? Schedule your sleep times, right? Have a bedtime, have a wake time. You know, it's important to have your time set up. When you know, it's like same thing with the exercise. If you just are like, no, I don't have an exercise time, I just go when I go, you're probably not going to go, or you're not going to go enough where it makes a difference. Same thing with sleep. If you're just going to be willy-nilly about what time you go to bed all the time, and some, you know, like some nights you go at 10, some nights you don't get to bed till 3 in the morning, so you're never going to get enough sleep. All right, you know, have a good routine. Sleep and depression. Insomnia can lead to depression. Again, it's not a direct link, but, you know, added with many other factors, and depression can lead to insomnia. Again, you know, when you're depressed and things are always running through your mind and stuff like that, yeah, I mean, these things make sense, right? So healthy sleep advice: set and stick to your sleep schedule. I already said that. Expose yourself to bright light in the morning, avoid it at night. You know, again, turn off all the lights and stuff, turn off all the gadgets and things. If you got too many like little gizmos in your room with too much ambient light, you won't sleep. Exercise regularly. Establish relaxing bedtime routine. create cool, comfortable sleeping environment that's free of distractions. Again, I don't know how people sleep in a hot house. That's just nuts. I'd rather have my house like it's freaking Alaska during the winter and put on some blankets. Man, that's the best. Again, I don't want to pay the electric bill on that, but that's the best. And then unplug, right? Just unplug from things. Unplug from all your gadgets, but unplug from life and get to bed. Try to get things out of your head. All right. Treat your bed as a sanctuary from stresses of the day. Keep a worry book next to your bed. I guess you write in that. Not really you guys will hear from me a lot. I'm not a write things down type of person, so that would not work with me. I would look at that thing and just make me mad. Be like, stupid book, I'm not writing in you. Avoid caffeinated beverages, chocolate, and tobacco at night. These all are can be stimulants. Now, again, some people, caffeine has a weird calming effect. It helps you to, like for me, it helps actually to calm me and focus me. I could actually drink coffee and go straight to bed. It's weird. It helps me to wake up in the fact that it like sort of, it doesn't boost like my energy. I'm not jittery or anything like that when I'm on caffeine. It just kind of helps my mind focus. It's really, again, we all are different. I know other folks, you give them a little bit of caffeine and they're like Sonic the Hedgehog. So is what it is. Avoid large meals and beverages right before bedtime. When you eat, your metabolism has to kick in to now move all this food around through your digestive system, right? So you basically gave your body some more work to do, all right? And no nightcaps. So again, alcohol at night can give you weird dreaming patterns and things like that, and not good rested sleep. Avoid medicines that delay or disrupt your sleep. Anything that's a stimulant would do that. Again, you got to be careful with vitamins. Don't take vitamins at night, especially B vitamins can keep you up. No late afternoon or evening naps unless you work nights. Again, naps will delay you feeling tired to get a full night of sleep, right? A little different with kids. So, if your kids need a nap, they need a nap. Again, if you want to do a foot soak thing, you can do that. There's a lot of things. Some people like to drink milk before they go to bed. There's whatever like kind of puts you in a tired mood. I've got a daughter that gets really tired every time she reads. So reading right before bed's a good thing. Might not be the best for her to comprehend what she's reading, but it'll put her to bed. Again, individuals with high stress level are more likely to be smokers than those with low. Nicotine is dangerous and highly addictive. Again, we not only see the problem with tobacco, but you see this problem now with vaping, which probably, I don't know if that was really much of a thing back when this book was written. Again, there's no health benefits with either one. Okay. College students engage in various risky behaviors, including alcohol use, tobacco use, physical inactivity, unhealthy eating practices. Again, it's one of those things. Nobody's around to tell you to do the good things, so a lot of times we like to rebel. And again, it's not good. When they get out of college. I got a lot of friends that when not friends, but just folks that I graduated with, and then when I came back from college, I kept, or not only kept, but actually adopted a lot of healthy behaviors when I was in college. And I got back and I see like a lot of folks that I grew up with in high school, when I run into them, they age so much, we're the same age, but their bodies just age so much, like they were not as recognizable, right? And they just, they're unhealthy. Only 3% of Americans follow healthy lifestyles. Again, I would like to see what this book, where they got that, because I want to know exactly what they would call a healthy lifestyle. Because again, some people, some people have a very loose meaning. Some people have a like overly strict. On this one, it says healthy is not smoking, maintaining healthy body weight, consuming 5 or more fruits and veggies a day. Most people have probably have no idea if they even do that. And exercising at least moderately for 30 minutes or more, at least 5 days a week. Again, a lot of people are going to probably have a tough time figuring out what moderately is, you know. Overall, African Americans consume less alcohol per person than whites, yet twice as many African Americans die from cirrhosis of the liver each year. You know, how would you interpret that? You know, maybe, you know, there's a lot of reasons. You know, one possible thing would be overall in, you know, in that particular culture, you have folks that really stay away from it, and then you have folks that really maybe abuse it. So you have folks at both ends possibly. Um, you know, where maybe in the white, you know, and again, white culture, you know, it's kind of weird when you say cultures, because a lot of us all grow up together in the same areas and the same, you know, maybe even have a lot of the same traditions. But you know, if you're going to look at that, because it says culture collection, if there's a white culture and African American culture that's different, maybe overall more whites engage in drinking, yet have less folks overconsume, possibly. I mean, that would really be, you know, I mean, that's one possibility. There's probably, you know, that's the thing. There's a lot of things that could play into that. Um, you know, maybe the problem is too is maybe, you know, whites develop, you know, like their body develops a resistance from drinking more alcohol. And then when somebody does overdrink a little bit, in the African American community, if they're drinking less, you know, their liver isn't necessarily accustomed to, you know, like overconsumption or binge drinking or something like that. Who knows? You know, it's, you know, it's one of those things that they do these, you know, they look at surveys and then they take health reports, you know, and sometimes these things are like, okay, that doesn't make much sense. Again, this is where you need further investigation to actually figure out the culprit. Hispanic cultures tend to discourage drinking by women, but encourage heavy drinking by men as part of machismo. Hispanic men have higher rates of alcohol use and abuse than the general pop, yet few enter treatment programs. Again, you know, it's only a problem if people are willing to admit it's a problem too, right? So, you know, in the culture, it may be more, like they said, it may be, since it's encouraged, for the men to be heavy drinkers. You know, and again, this is going off what this says. You know, I haven't necessarily seen this, so I don't know. You know, um, but maybe it's not necessarily seen as bad as maybe you might see in the African American community or white community, where they're, you know, like you have heavy drinkers and everything that comes along with that. They're like, look, you got a problem, you need to go deal with it. I don't know. So again, you know, there's a lot of explanations when you see things like this, right? You know, it's they're just kind of thrown out like these, like, oh, here's this and this, right? Not any, you know, not really offering up any explanations, right? Native Americans have 3 times the rate of general pop of alcohol-related injury and illness. Both the biological predisposition and socioeconomic condition may contribute. Some tribes, 10.5 out of every 1,000 newborns have fetal alcohol syndrome, compared to 1 to 3 out of 1,000 in the general pop. Again, a lot of disparities in Native American cultures, especially when you get out on the reservations. I grew up near, like right outside of a couple different reservations, and yeah, definitely, there definitely you see some disparities, and this is one of the ones that you see. And again, we don't get to see these in national average things a lot of times, because the Native American population is so small compared to the white African American and Hispanic communities. Um, so you don't hear as much, but if you look state by state, with states that have higher amounts of Native Americans, look at the health disparities. You know, and again, definitely there's a huge need for programs to go and help those communities. Okay. Asian Americans tend to drink very little or not at all. May relate to cultural values, may relate to inborn physiological reactions to alcohol. You know, So again, maybe something that's just like, carried in their culture, like they're not going to drink much, or like they said, they may have different physiological reactions. Facial flushing, rapid heart rate, lowered blood pressure, nausea, and other unpleasant symptoms may be part of the physiological that they deem might keep them from drinking as much. Men are twice as likely as women to develop alcohol dependency. Um, Again, men have more than a 1 in 5 lifetime risk of developing alcohol abuse or dependency. Genetic factors account for 40 to 60% of risk for alcohol use disorders, and the environmental factors. So again, I don't know that the genetic factors would necessarily be for the men versus women, but like you look within family issues. And again, the other thing is, you know, uh, is the alcohol availability, attitude towards drinking, peer pressure, stress levels, coping strategies, drinking laws, being a regular smoker. And another thing is too, is with guys always sort of have this weird macho, like, got to out, like when there's a bunch of guys together, there's a lot of alcohol, you know, there's always competition. Who can drink? It's like everything. With guys, there's always competition, right? Those things could all play into it as well. And with developing habits, right? That's why why I think I developed an overeating habit when I was younger, is because it was always like, who could eat more, right? Drinking by adolescents and young adults is influenced by unique factors: increased sensitivity to stress, increased propensity to initiate alcohol use. Again, there's this, kids feel more adult when they start doing those things at younger ages, I guess. On campus, stress-related drinking is common. Athletes drink more than non-athletes. Fraternity members are among the heaviest drinkers. Again, it's encouraged within those communities. Stress and alcoholic. Among alcoholic men who successfully completed treatment and then experienced severe stress, those who resumed drinking experienced twice as much severe and prolonged stress before their return to drinking as those who remained abstinent. Again, people turn to things when they're stressed, and they will turn to an old habit when they're stressed, whether it's drinking, smoking, overeating, so forth. People may drink because they think it will help them reduce stress. More than 1 or 2 drinks per day can lead to many problems, including alcoholism, liver disease, various cancers, many types of accidents. Again, drunk driving would be one, machinery accidents, so on and so forth. Drinking is also associated with other unhealthy behaviors such as smoking, sexual aggression, and violence. Your inhibitions are down, you're not thinking straight, you do things you should not do. Drugs. Choosing drugs as a way of coping with stress is an unhealthy choice with many negative consequences. With legalization of marijuana in some states, its impact on health should be monitored. And again, this will be interesting as we see more and more states legalize it, and its impact on health, right? Stress and drug addiction. Stress may be one of the most powerful triggers for relapse into individuals with addiction to drug. Again, you go to bad habits, right? You go to things that try to take you out of your real world scenario, even after long periods of abstinence from abused substances. So again, understanding that making healthy choices and living healthy lifestyles fundamental to well-being. It's not a new idea, but again, this is just kind of putting into play, like, the practicality of all of this, right? So while you can't shut out stress and illness entirely through healthy lifestyle choices, you can make your body a place where health thrives. And again, I hate that we call what we do prevention. What we do, is not true prevention. It's not like getting, like if they're, like the vaccine for polio is prevention. It keeps you from getting polio. What we do mostly is mitigation. Like we're lessening the effects of what's going to happen to our bodies. We're lessening the chance we're going to get disease. We're lessening, we're playing the best hand we can. We're playing the best odds we can. It's not true prevention. I don't like when people overstep and say, by doing these things, you'll live a long, healthy life. You know, you can get a heart attack when you're 30 and be completely healthy. You know, sometimes just things happen. But we're mitigating the possibility of those things, right? We're lessening the chance. We're playing better odds is what it is. Okay. All right. So that's that. Stop sharing. All right. That's chapter 15. If you have questions, comments, concerns, please let me know. I'm going to stop the recording.